Okay, so principles of fitness testing. This sounds better than it actually is. We'll talk about the details of fitness testing a lot more as we hit different sections: aerobic, resistance activity, core, all that sort of stuff later on in the course. And then we'll hit some of these principles of fitness testing or complete actual fitness tests when we complete uh, different aspects of the lab. So this is just kind of talking about some overarching themes. So most of the information will come out of the Hayward text. The ACSM also covers some of the materials that can be used as an adjunct to this text. I find that the for later chapters, the Hayward text does a nice job kind of addressing what's out there. So kind of keep that in mind, and keep that in mind that when you're completing a fitness test or fitness testing, that a lot of times you have to individualize what you're doing, make it specific to your population or what you're trying to accomplish, because it may be that there's nothing really out there that exists for it. Think about what you're trying to accomplish with the fitness test. So, a lot of times for me, the way I teach this course, I'm addressing the general population. So that's the lens that I look at things through. However, if you're trying to work with a specific sport, uh, football, baseball, basketball, soccer, tennis, you may complete fitness tests that are completely different, that are useful, or you feel that may be potentially useful for that specific sport, and that's absolutely okay. How does the test help you reach your goals as an exercise physiologist? Do you need to develop something better to fit your needs? So, especially when you're getting into specifics, there may be tests that don't exist that you could complete, that you develop, that really help address what you're trying to find out. Standardized and validated tests are better, and sometimes the tests don't exist that you're trying to learn for your client. So keep that in mind. The purpose of the fitness testing, similar to the purpose of an exercise prescription. Health screening. So if an individual's fitness level is low, that may indicate that they're at increased risk for disease, chronic disease. So from that perspective, we can find out health issues or orthopedic issues or general chronic disease issues. Develop a fitness profile. And that goes along with the next bullet, which is identify strengths and weaknesses. So if there are things that an individual is good at or not good at, a weakness, then those are things that can be identified, and you can get a good generalized picture of what is the fitness of this individual. You could set goals based on what your results, how much improvement can you see, and how much improvement is reasonable. So if somebody is let's say running at 4 miles an hour, to get them to run at 4.5 miles an hour after training may be reasonable. But if they're running at 4 miles an hour and you're trying to get them to 8 miles an hour, and I've seen this in some exercise prescriptions, that's not reasonable. That's not going to be appropriate, at least not for quite some time. So setting reasonable goals will be important. And in so doing, you're aiding in the exercise prescription. And then to evaluate progress. I mean, you want to see how much an individual is improving. And doing a fitness test, completing a fitness test will help to determine. So that would be more the post aspect. The pre would set initial values, and post would help you evaluate the progress. Testing order. Testing order can vary, and it's often due to practical factors. So that we have a list here that you can do, but it depends on what you're trying to accomplish. Generally, resting measures would be taken first. I think that's pretty consistent. Blood pressure, heart rate. Body composition and balance would be completed next. Part of the issue there is body composition. You're usually touching the individual. And in so doing, if they're sweaty from an exercise bout, then it's like the ick factor. So it'll be gross for you, and the client will also feel uncomfortable having you touch them. So that's the reason why it's put early on. Balance. You don't want the fatigue from the other tests to affect your balance. And if you complete the body composition and balance first or early on, it will not affect the other measures that will be completed. Cardiorespiratory endurance, muscular fitness, I think you could really go either way in which one you should do first, and it may be up to the individual's preference. Flexibility. Flexibility, you would run a warm up before you complete the flexibility measures. So again, it's what's the logistics? I mean, if you did a warm up and completed flexibility earlier, that would be fine. The order is not necessarily set in stone. Quality of tests, we have validity and reliability, objectivity. These are actually very important. So validity is if you complete the test, how accurate are the results. So if you have something like body composition and you have a body mass index, the body mass index is not necessarily always valid, especially in a college-aged male population. So the individual may be overweight and obese, but that's because they're carrying more muscle mass. So we want to make sure that the results that we have are valid, as opposed to something like skin folds. If skin folds are completed correctly, they would be valid and more valid than body mass index in determining body composition. However, body mass index is reliable. If I do it and you do it and we complete it 10 times on the same person, we'll get the same results every time. It's not very difficult to get somebody's height and somebody's weight. So it's reliable, which means that it's repeatable. We'll get the same results every time. However, if we got 10 different people from the classroom to complete skin fold measures on an individual, the results might not be super reliable, which means that we get a real variety of values. Some might be very high, some might be very low, and we want to make sure the results are correct. So the reliability, especially in somebody that's completing the measures for the first time, may not be the best. In objectivity would also be good in body mass index, because no matter who's taking it, the values are going to be the same. There's nothing in there where you have to use your judgment. So like functional movement screen, where we're evaluating movement, and if people are able to move and complete certain movement patterns correctly, that's a little bit up to my opinion, your opinion, what counts, what doesn't count. It's objective, or it's subjective, which makes the objectivity aspect lower. So if it's something where we all come up with the same assessment, that's good. It's not always there. Push-up test would be another example. Watching somebody complete push-ups, one person might count a push-up, another person might not count a push-up. So we have various fitness measures, and again, we'll go over this more in the lab, and we'll go over this in future sections, but it gives you kind of an idea of what's out there. Cardiorespiratory endurance. I'm a big fan of cardiorespiratory endurance, and I'm a big fan of doing maximal graded exercise tests, or GXTs. What that is that you're increasing the intensity at regular intervals until you feel like or not you, but until the subject feels that he or she cannot go anymore. So that would be volitional fatigue. There's different ways to measure that, and we'll discuss that in later sections. But it's measuring your aerobic fitness. Body composition, there's a variety of measures, measuring percent body fat. So bioelectrical impedance will complete in the lab, skin folds, anthropometric, so height, weight, circumferential measures will all complete those. The hydrodensitometry, underwater weighing, we won't. The DEXA, dual X-ray absorptiometry, we won't. The BOD-POD, which is air displacement, we won't complete those either. They're considered the gold standard, but we do not have access to those in the lab. Strength measures, 1 repetition max is the standard there. You can also complete submaximal tests for typically 2 to 5. They list 2 to 10 in the text, but those are usually fairly good. And Even if you don't complete it perfectly, uh, if you complete it pre and post and you complete the methods the same way both times, then you should be able to see changes from one time to the next. Bone strength, that's really dual X-ray absorptiometry or DEXA. We typically don't do that too much in our settings. Flexibility, range of motion. Physical therapists will do this much, much more than we do. You could do that via goniometry. In the lab, we do this more through a movement assessments to see how well people are moving, more than anything. You could also complete it. The sit and reach would be examples of it. I'm not a big fan of the sit and reach. The back scratch test to look at shoulder flexibility would be another measure. So there's different things out there, but there's nothing really good that's consistent that looks at the whole body, unless you're you're looking at joint angles, and really that's not completed on any sort of regular basis either. Balance, there's no good reference measure for balance. I think there's a lot of things that you could do to kind of, I would call it a proxy, so to kind of get at the balance level. One-legged stands are on different surfaces are something that can be done. Completing various tasks are something that can be done. And it goes back to what's your philosophy? What are you trying to accomplish? If you're trying to look at a sport performance, then you could do sport performance types of activities. If you're looking at an older individual, you want to check to see if they will or will not fall over. What's their ability to walk? So you could kind of take those issues or problem areas and see, okay, how do they perform on those things? The key for you is if you do that, there's no real data on it. Doesn't mean, but that's okay. It can still give you information. You just want to make sure that your methodology is standardized. Usually, if you're doing it every single time, it'll naturally be standardized. It's your standard. You run into a problem when different people are doing it to make sure that everybody's on the same page. So we have exercise prediction equations. Some of the things that go into it: large sample size. The larger the sample to predictor variable ratio. Large R and small standard error, applicability of prediction equations, cross-validation with small errors. Essentially, and part of this is also when you complete the measures that you're doing it within your population. So if you're looking at a prediction equation in older individuals, to develop that data on older individuals may be more accurate for older individuals. If you did the same thing on younger individuals, college-age students, it might not work as well. It might, but it might not. So when you're looking at some of these prediction equations, I think that's kind of important, if it's possible, to look at how well was this prediction equation developed for a specific population. An example of this would be the densitometry equations, the equations to determine percent body fat. They did this in a white sample for the most part, and they developed the equation, and they had African American individuals that would do the underwater weighing and use the equations, and they were coming out with body fat percentages that were less than physiologically possible. So they realized that the tissue of African Americans, the bone, the muscle, was denser, and new equations needed to be developed. So sometimes these prediction equations are great. Sometimes they might be a little bit off. They get you to a good general ballpark, and I think that's important, that you have an idea. And you're looking at some of the purposes of the exercise testing. You're looking at pre and post values. So by completing these measures, even if there's error, there should be the same error pre and post, and you should still be able to see a difference pre to post. Pre-test instructions to the client. I think we addressed this in a previous PowerPoint. Directions and arrangements for facility use, clothing recommendations, dietary and exercise restrictions. So this was previously addressed. And for the test, I'll use that previous PowerPoint. So test administration and interpretation: use standardized protocols, use established age and gender specific norms, avoid technical jargon, be positive and supportive. So really with the technical jargon, you want to break it down and translate that information for things that they can understand. Ideally, the same person should conduct the test pre to post. So if you have a certain level of error, you don't want the error to be, well, I'm overly aggressive with my skin fold measures. People tend to get higher percent body fats when I take the measure. Then you take the measure, you're less aggressive. People tend to get lower values when you take the measure. If I take the measure first, if I take the measure pre, you take the measure post, then you might see a change, but that change is just because two different people took the measures. If I take the measure both times and there's a change, we should see it because I will be aggressive both times. And if you take the measure, then you should also see a change because you're not aggressive either time. So the methodology should be consistent in the way that you complete a test. So, if at all possible, keep the test administrator the same for pre and post testing. Not always possible, but ideally. And specific tests for different components of fitness will be addressed in later sections and in the lab. Okay.